Hey guys, Don here. Welcome to the $1 Million Minute. Trying to help you get to the $1 million mark and beyond. This was my first day back after a few days of vacation. We went to Florida with the kids. We had a little church seminar over the weekend, and then we took a couple of days. We went near Cape Canaveral, and we saw, it was kind of funny, when we arrived on Friday, we saw the SpaceX kind of going up in the plane when we were there. It's kind of cool. And then on, I think it was Monday, we watched the other launch from the beach there. So it was a fun time to get away with the kids, kind of disconnected from business and everything else like that. I had kind of an interesting conversation today. There's a gentleman. He's an older patient, but he was part of Strategic Coach for a number of years, and he's kind of a creative, kind of a entrepreneur type of a thinker. He is a accountant, and what he did is he used to do a lot of talks to CPA. So his whole approach was doing talks to actually financial planners, and then they would refer to him as a CPA. That's kind of how it worked. But he had a neat idea, something I've never heard of. So I don't know, maybe you guys have heard of this. It's called a decision tree. This is something that he kind of used as he was helping people to make decisions, or as clients make decisions. And I thought it might be applicable to us. So what is a decision tree? Basically, it's pretty easy. So give you an example, and this is an example that he used. So when you travel somewhere, so I went to Florida, he said, well, you can go, there's different ways you can get there. There's different mechanisms or vehicles that you can take to get there. You know, you could walk to Florida, which would take you a long time. You could bike there. You could do an Uber. You could take a train. Okay? And so those are all they're slower, but they would get you there. They'd be maybe less expensive, but you don't have as much speed. And then when you talk about flights, then there's different things with the flights. You can go economy, which we went. You can go economy plus, where it's about the same as economy, but maybe a little bit more leg room. And then there's first class, and the difference between might be $300, $500, and then maybe $800 for the difference between those. So he kind of goes through this when he talks to patients or his clients that he's using. I'm going to explain to patients. So I can use this, and I can say, well, let's give an example. When you're treating, for example, plantar fasciitis, there's different ways that you can get there. And usually people, they pay more for speed or ease of treatment. And then as you're going through these things, you can get better with you can try to do icing and anti-inflammatory, which isn't all that effective, might eventually work, or you can do a cortisone injection, which tends to be more painful, might not last as long, or you can do the shockwave treatment. So kind of giving them this, and then having them, well, which makes sense to you? Which one do you want to do? So there's a couple of philosophies. Some philosophies say we should tell them what they should be doing all the time, and others kind of have them make the decision, so it's on them and what they would like to do. So and if they ask, well, which is best? I think a lot of times patients said, what would you do if it were up to you? Well, I don't know in the future, but I like the ones with the highest guarantee. This is kind of what he said. And it's true. Which ones have the highest guarantee? In my opinion, the higher guarantee for me is more the shockwave and things like that. So anyway, it was a nice idea of how to apply this to our practices. Anyway, let's get into the day. Someone asked me the other day, they sent me an email, so I'd just like to address this, about billing and coding. That is not my specialty. So as I'm talking about like level visits here, things like that, you would have to talk to a billing or coding specialist. There are a lot of people in the APMA that do this. I'm just kind of sharing what's working for me. The particular question was, when I do medication management, why am I always doing a level 4 visit? I am based on that, like AMA guidelines, medication management, depending on the number of things I'm dealing with and the complexity. Most of mine I'm doing level 4 visits, like doing a terbinafine or doing an antibiotic. That's kind of the rationale. Most of my other ones are like level 3, very low. Few do I do level 2. Okay, so the first one was a Lamisil follow-up. He's doing much better. This was actually the guy that I got this idea from, and so he's doing well. Another patient that came in, this is a patient with a neuroma removal. She's doing fine. And a Taylor's bunion. This is a post-op, and then I don't need to see her back anymore. I got x-rays for that patient. Another patient came in. She's a 51-year-old female. She had a couple of things. She had a kind of a rash between the first and second toes. It's kind of a scaling rash, and I was able to curette it off and did a curette biopsy, so I'm going to see her in 3 weeks for that, thinking it was tinea pedis. She also had some pain to her foot, possibly in Morton's neuroma. Didn't have a Mulder sign. Gave her meloxicam, contrast baths, and I recommended Naboso. So Naboso are the splay toe things with anatomic shoes to kind of take some of the pressure off of there. And I'm going to see her back in a few weeks to go over the biopsy and see how she's doing. If she's not doing better, then we'll talk about an ultrasound and possibly either cortisone or shockwave. Another patient came in. This is a 39-year-old female. She had sesamoiditis for a number of months. Wasn't getting better. We did 3 sessions of shockwave. She was all better. So I did do a video on that for her. I took my cell phone out, recorded it, used an app called... what's it called? I think it's called Click Scribe or Scribe Magic or something like that. And I had a transcription. I put it under YouTube, in my YouTube, but I also put it on the my patient education sheet on sesamoiditis. So I have a testimonial on there now. So it's just kind of a way to use video testimonials for patients. Another patient came in. This is a patient. She had first MPJ pain, and I recommended for her a carbon fiber inlay to reduce the bending. And I also recommended shockwave for her, so we'll see if she'll do that. We got x-rays on that patient as well. Another patient came in with an orthotic follow-up. She was doing well. I'm going to see her back in 3 years. Another patient came in for a meso dispensing brace. This is a brace, if you don't know, it's an Arizona brace for the midfoot, for midfoot arthritis. He had done well with a cortisone injection in the past, but due to the arthritis, that movement would tend to come back. The pain would come back, so that's why we did the meso brace. Another patient came in for a Lamisil booster. This was the second Lamisil follow-up. Another patient came in for turf toe. This is a young man, 24-year-old police officer, and we did meloxicam, and I'm going to see him back to see how he's doing with his turf toe. Actually, no, this was the police officer. This guy was he's a guy that likes to do pickleball, 24-year-old pickleballer. Next patient was a 29-year-old. This was the police officer. He had a wart on his left foot, so I did cantharidin. Right foot, he had some tinea, so I did a biopsy to the area to verify if it's tinea or eczema. And I'll see him back to go over the biopsy results and also see how he's doing with the cantharidin and most likely reapply that. Next patient I saw here, this is a patient that follow-up fibular fracture, doing well, and now has some sinus tarsi pain. He's traveling to India, so I did not do the cortisone today, but if it continues to be there, I will do a cortisone in the future. Another patient came in. This is a patient, she has a chronic Achilles pain, kind of bulbous change on the left side, proximal to the insertion, and just a lot of tightness in the back of the calf. I can tell she's not doing her foam rolling because just the calf is so painful. So I did recommend and reinforce foam rolling, and she's also going to do 3 sessions of shockwave. I'm going to set her up for that. Another patient came in. She was a patient that we've been trying to deal with plantar plate tear due to a dorsally dislocated second toe. We tried to do the shockwave to see if it would calm it down. It did not calm down, so she's going to need to have a bunionectomy with a arthrodesis of the second toe and possible plantar plate repair. Another patient came in for an IND of an abscess. This patient, the abscess was there, though, I think because they used too much salicylic acid on a possible wart that they had, and so it just kind of injured the skin and caused a little bit of a superficial infection. So I did an IND on that, and I said not to use the salicylic acid anymore. Another patient came in for a wart, almost gone. I put cantharidin on, and I'm going to see them back in 3 months. Just a longer visit. So usually the last one, like when I think it's almost gone, I'll still put either salicylic acid or cantharidin, and I'll put a really long follow-up. But if it goes away, I'll ask them to cancel it, and I'll also tell them, my staff, to double book these. Also, there's another patient that came in for peroneal tendon pain. She's having pain kind of all on the lateral side of the leg and the peroneal tendons, and I did a shockwave for her. And there's also another patient, shockwave number 3 for first MPJ arthritis. I don't know about you, but first MPJ arthritis can be a challenging one. This patient, she is a nurse practitioner and has like a aesthetics practice. She has a first MPJ that needs a fusion, but she's not willing to do the fusion. So I'm doing a shockwave on there to try to get down some of the bone marrow edema underneath the cartilage. Not that it's going to grow back the cartilage. She's well aware of that, but hopefully it'll cause it to be better. She already has a carbon fiber plate in her shoes. She has orthotics, things like that. So anyway, that was the day. Once again, I hope you guys are enjoying this. If you want to learn more, go to Podiatry Practice Mastery. Also, I have a few spots for anyone that wants to come and visit. It's always fun for me. It gives me a good way to make more content as I'm teaching and learning with other people. But if you're interested in coming to my practice here in Massachusetts, I invite you to come a day. I know it's hard to get time in your schedule, but I think it would benefit you, and I'd be happy to share kind of everything and how I work and use the scribe and my presentations and things like that. Let me know if you're interested. Send me an email, Donna at podiatrypracticemastery.com. Okay, thanks.